Hey gang, it's your old buddy Wildcard here, checking in with you. It's been a while since I've posted any videos, and may not be posting many more for the foreseeable future, as you'll hopefully understand as I explain what may have been Wildcard's last ride. That big fine white Peterbilt I posted the last video of about the local job and everything I got, which I'd left Maverick for. Just started that out. That was going well, and long story short ending, found out that I have stage 4 metastatic melanoma cancer, stage 4 cancer on my liver and my lungs. Consequently, can't work, can't drive. The pain and nausea just from the tumors is overwhelming. They're just starting to get a handle on the pain, and I've been dealing with this for a while. Give you a quick backstory. Well, I'll give you a little bit of the insight in case this might help somebody with your own health concerns in the future. Back in the summer, man, long about April or May, I started having this odd pain, just below my rib cage, kind of like just in that abdomen region. And it felt like a subtle pulled muscle. It wasn't there all the time, and it wasn't bad, but it was noticeable. And it was right around that time frame that I was changing. Sorry, I can't breathe real deep, so I gotta catch my breath. It was right around then that I was changing my exercise routine, so I thought I must have pulled a muscle or something. Better take it easy. So that came and went most of the summer. Didn't think much of it, but then it started to get a little worse along about September. I started noticing the pain over a little bit further and down a little further away from my rib cage, whereas before it was kind of centered. That was kind of moving down away from my rib cage, but still pretty close to my rib cage, and then my side was starting to hurt a little bit. About the end of September, I started getting those pains intensified, and I started getting pains in my side, like on my rib cage, and I thought, man, I must have pulled a muscle, as I'd been changing my push-ups again and doing planking and doing dips on the side of the truck, and making a hard effort to get into better shape, and thought that I'd pulled something, so I figured I'd better just forget about it, take it easy. That pain, even having ceased all my exercise, I quit working out for a good month, and all through October it would come and go for seemingly no reason. This pain would just come and go. And me being a hardhead, I don't want to go to the doctors. I had a couple family members are telling me, "Oh, that's your gallbladder, buddy. You gotta get that checked out." But being a hardhead, didn't want to do that. So anyway, November, it was a Friday in the middle of November. I was supposed to be coming home empty. I was still working for Maverick, and I had a little bit of that pain right there in my abdomen that morning. And it was a Friday. I was supposed to have been coming home empty because my wife and I were going out of town, and Maverick put a load on me, which, was kind of upsetting, but it was literally on the way home. And they were cool with me delivering it late because I had my special request in. I wasn't coming back out till later Monday afternoon. Sorry, catching my breath again. So, but I'm still aggravated because I had planned to have been home that morning and get on the road to drive to Maryland. So I've got this load of lumber on the truck, and I'm outside the truck throwing straps over this lumber, and it's a pretty tall load of kiln dried lumber. So I'm having to, get the straps way up there. A couple of them missed with the forward technique, so I got the whole, rewind it just enough and stand and then kind of heave it sideways to get it up over the load. And as I was doing that and tightening the straps down, my whole side just lit up. That all area in my abdomen and my rib cage, pain was through the roof, man. I didn't think I was going to be able to finish strapping it down, much less securing the tarp. All up through my shoulder blade, top of my shoulder, and the back of my shoulder. The worst pain I can ever remember feeling. And here I am. They had a roller to roll the tarp out, but I still had to secure the tarp. And it took me hours to do that because I could only use one hand. My other hand, I had to take my arm and press on that area of my abdomen just to get it to not hurt enough to where I could take the most shallowest of breaths to keep going. And drove the 3 hours home and had a miserable weekend visiting family. And a buddy of mine up there told me, he said, yeah, same thing happened to me. That's your gallbladder, man. Well, I cleared up, got better, didn't think much of it, but it would come and go, like out of nowhere. In the middle of the week, I'd get that pain again, but it wasn't ever quite that bad. So I didn't think much of it. And then ended up finding this local gig, put in my notice at Maverick. My last day at Maverick was December the 6th. And I came back home. I was going to take a little time off and ease into this local job. And was doing that. He was having another truck put on the road, and coincidentally, a guy had quit on him, so he had a truck open. So I jumped in and started working, and everything was going good. His pain was getting worse and worse, and I thought, man, this is just not great. And the week before Christmas, it woke me up at night. It was so bad that I went to the emergency room. It was that bad. Of course, the emergency room in my little town, being what it is, was ridiculous and couldn't be seen. So I just ended up going home. Made an appointment the next Monday for my family doctor. I get in there and they think, yeah, man, it's your gallbladder. But I was telling them it got worse with physical activity, which the gallbladder shouldn't have done that. So they're thinking it might have been my appendix. Pardon me. So they order a CT scan of that gallbladder appendix area so they can get a look at it. Well, I go and have that done, and that's when they discover tumors all over my liver. And tumors, what they could just barely see of the one lung that happened to be in the picture. They weren't shooting the picture for that, so they only got one little bit. So they referred me, my family doc referred me to an oncologist here in town, a cancer doctor. See, in 2018, I had surgery up here for melanoma, which is often a skin cancer, but it can go internal. And when it does, it's bad. I had a freckle that started out as just a little freckle on the side of my face. It was just outside the edge of my beard. And it got bigger and bigger, and my wife kept saying, hey, you should go get somebody to look at that thing. And so I finally did, and that turned out to be stage 2 melanoma. They did 2 surgeries up there, removed some lymph nodes for testing, and pronounced me all clear and said to keep following up with my dermatologist, and that's what I did. Hindsight being 2020, I should have gone to an oncologist, but be that as it may, flash forward then to December when I have the CT scan done. So find out that there's tumors on my liver, pretty sizable. The largest one at that time was 3.5 inches, 7 however many centimeters. So they did a liver biopsy where they stick a needle in there and actually extract some of the tumor for comparison and testing. And they found out that it was indeed this melanoma metastasized from the 2018 event. The prognosis isn't great. 5-year survival rate is 30% of the people that have this cancer make it 5 years. So that kind of stinks. But I'm in decent enough shape. I intend to fight like hell and be among that 30% of people. They did a bone scan and an MRI, and praise God, the cancer didn't go any further than that. They also did a complete CT scan of my chest and thorax, got both lungs in the pictures, and there are tumors on both lungs, none of which are huge, but they had the ones on the right lung that they had the picture of when they thought it was my gallbladder. Those had gotten bigger even in the 2 weeks since the previous CT scan. So the option with this type of cancer is immunotherapy. There's no surgery. Chemotherapy is ineffective. So they do what they call immunotherapy, which is where they basically use a combination of drugs or a single drug, depending upon the situation, to like supercharge your immune system so that it attacks the cancer more vigorously. Of course, it attacks everything else, so you don't want to get a cold or the flu or anything. You want to be as healthy as possible, except for the cancer. So I had my first treatment of that just over a week ago. Get some side effects from that: pain, nausea, fatigue. The fatigue is just crazy. I can barely walk across to the other side of the house and back. And the pain is pretty bad. They're just now starting to get the right combination of narcotics to control it. As in yesterday, I just had a doctor's visit. But the first immunotherapy session seemed to go well. I'm getting some of the side effects. It takes about an hour and a half for this intravenous thing to pump the drugs into you. And I'm getting some of the side effects: the pain, the fatigue. I got sores on my tongue and my mouth, which is a side effect. I've got a rash on the backs of my hands and on my chest and on my back, which they say is one of the side effects as well. So they've got me on another medication, steroid, to help with that. So I think all told, I'm taking 6 or 7 different medications now every day. And then I'm taking the Opdivo and Yervoy. Yes, Opdivo and Yervoy are the 2 immunotherapy drugs that I'm being given. They give those every 21 days, and then at the end of 21 days, they reshoot the CT scans to see how the tumors are responding. If they've gotten smaller, larger, more numerous, what have you, and then they reevaluate from there, whether they change the drugs, increase the drugs, whether they do any changes. It's based on your CT scans every 3 months. A full course of this immunotherapy lasts 2 years, and that's depending upon what they see every 3 months. They don't ever expect much out of the first 3-month session, because it takes a while apparently for your immune system to get ramped up and then focus on the cancer. So you feel worse before you feel better. So that's kind of what I'm experiencing right now. That's the cancer isn't not curable. It can only ever be treated. So I'll always have this cancer. The best I can hope for is that there'll be no new evidence of disease. So it's just a treatment and a monitoring thing. I'm hoping to get back to work, but as of yet, I can't work for the narcotics and the pain and the fatigue of it all. So some family members of mine in Maryland graciously actually started a GoFundMe page to try to let some friends of mine know that I was having this condition, and just put it out there, man. I have a hard time asking people for help with anything that I do in life in general. I'm one of those guys, I want to do it myself. But you know, sometimes you get to a point in life where you just have to ask for help. I'm already taking the measures that I can take. Financially, we've changed, our monthly spending quite drastically. Begun selling off some of the more valuable books in the library behind me. I'm going to continue that, and that's about all I can do at the moment, and just ask people to keep me in their prayers for sure. So if you're the praying kind, I would definitely appreciate your prayers, and if you feel so led, I'll put a link up here for my GoFundMe page. If you feel led to donate, bless you and thank you for that. Or if you just want to share the link to maybe your social media or however you roll, or if however you feel led, I would appreciate it, and hope that this video has been helpful. At least keep people aware of what's going on with your body, man. If something doesn't feel right, something might not be right. So get to the doctors and get it checked out sooner, especially, heaven forbid, if it turns out to be something serious. The sooner you know that, the better. And, wish I'd have known this sooner than now, but I know it now. So, now the fight begins. And I'll try to keep you guys posted as much as I can, but I won't be having any trucking videos anytime soon. But hey, we'll be back before long, and hope to be back in full swing. And just want to thank everybody for coming along on the journey. Hope all is well with all of you. Take care.